Okay, hello everyone. Our today's topic of discussion is oral glucose tolerance test. Although this test is obsoleted now, but this is your very important part in your biochemistry practical examinations. Especially, they will ask in spotting examination. Okay, but it is important to understand the theory behind it, and it is also mentioned in your competencies also that you have to interpret the result of blood glucose levels, okay, and other laboratory investigations related to the disorders of carbohydrate metabolism. So one of the part from this competency is oral glucose tolerance test. Okay, now going into detail, as the name implies, oral glucose tolerance test is the test which evaluates individuals capability to metabolize glucose load under standard condition. This is very much important topic and very much important, so just carefully understand the concepts, and is being tested by serial measurement of blood glucose. Serial measurement means I will take the blood glucose level before giving the load, that is at 0 minute, then at 30 minutes, and then 60 minutes and 90 minutes and 120 minutes. This is how they are taking the samples, and it is always supplemented with urine examination also. Urine examination for glucose also has to be supplemented while we are performing oral glucose tolerance test. So what are the WHO recommendations before anyone wants to do OGTT? So what are the indications to diagnose gestational diabetes mellitus? Gestational means related to pregnancy. Okay. Postpartum screening of a woman for type 2 diabetes mellitus who had gestational diabetes mellitus previously. So first to diagnose gestational diabetes mellitus, second one is postpartum screening of woman for a type 2 diabetes mellitus who had GDM, to diagnose impaired glucose tolerance IGT in the patient with unexplained neuropathy, nephropathy and retinopathy with RBS less than 140 milligram per deciliter. You have to diagnose this, and you know from your diabetes classes that is neuropathy, nephropathy and retinopathy are important chronic complication of diabetes mellitus. So many times we find that RBS of the person is within normal range, but PP2BS, HbA1c are so much suggestive of diabetes. So to diagnose that, we will require indication, that is OGTT. As a part of epidemiological studies also, to study a blood glucose level in a general population and sample population, we also require this particular OGTT. Following standard conditions under which test should be performed are patient should not patient should take at least 150 gram of carbohydrate per day prior to 3 days. So that doesn't mean कि आपको शुगर ज़्यादा कंट्रोल करके रखना है 3 दिन के पहले, otherwise there will be a false satisfactory results, okay, that usually misses the diagnosis. Test should be done between 7 a.m. and 9 a.m. Patient should be fasting for at least 10 to 16 hours. Patient should be ambulatory, not for non-ambulatory patient. So non-ambulatory patient example is ICU patient, stroke patient. Okay, stroke patient. These are the example of non-ambulatory patients. Patient should refrain from smoking 1 day of testing. So you have to quit smoking before 1 day if you are actually doing. Okay. Procedure of test is after collecting the fasting blood and urine, 75 gram of anhydrous glucose you will give, dissolve in 300 ml of water. Okay, 300 ml of water may you have to dissolve 75 gram of anhydrous glucose, and this you have to give it to your patient and tell the patient to drink it over a 5 minutes, okay, period of 5 minutes. Thereafter we have to take blood sample also, and we have to take urine sample also every half an hourly. That means at 0 minute, then 30 minutes, followed by 60 minutes, followed by 90 minutes, followed by 120 minutes. So every half an hourly I will take urine sample as well as glucose sample, blood glucose sample. Okay, Plasma glucose in all 5 samples, including fasting sample, is assessed and urine is checked for the presence or the absence of glucose by dipstick methods. Okay. Graph is plotted with values of plasma glucose obtained and result is interpreted. Okay. So our basic aim for this lecture is to interpret the curve given to us in our examination. So for that, to learn the interpretation of OGTT curve, it is important that one should be familiar with WHO criteria for health and disease and also ADA criteria for diagnosis of diabetes. In the screen you are seeing the first table is for ADA criteria, in which you can see this part is very important. HbA1c, hemoglobin A1c is more than or equal to 6.5%. To diagnose a diabetes, fasting blood glucose should be more than 126 milligram per deciliter, more than or equal to 126 milligram per deciliter. PP2BS, that is postprandial 2 hourly blood sugar, it is more than or equal to 200 milligram per deciliter. And random blood glucose to diagnose as a diabetes, it is more than or equal to 200 milligram per deciliter. Okay. This qualifier we are actually more concerned with laboratory kind of things, but this is not so much important. But you should remember like this only, that if you take HbA1c, so standardized DCCT assay has to be NGSP certified, lab NGSP certified. Okay. Fasting के लिए there should be at least 8 hours of no caloric intake and 2 hours के लिए after 75 gram of anhydrous glucose, and random के लिए you have to take classical hyperglycemia symptoms or crisis. If it is you are suspecting in the patient, clinically suspecting the hyperglycemic crisis, then you will take random blood glucose levels. Okay. Now we will see the WHO criteria. So you can see normal, in a normal condition your pp2bs should be less than 140, and fasting normal blood glucose according to WHO is more than less than 110. Okay. HbA1c is less than 6.0, but that means less than 6. Impaired fasting glycemia, okay, you should diagnose if the pp2bs value is less than 140, fasting blood glucose less than 110, and your HbA1c is 6 to 6.4. Impaired glucose tolerance, you should diagnose at pp2bs 140, fasting blood glucose less than 126, and HbA1c is actually 6.0 to 6.4. Now we will take the examples of OGTT and its differential. So in the screen you first see, this is first example in which you can see the patient having a fasting blood glucose of 79, in which that means at 0 minute your Benedict's test on urine sugar is negative. At 30 minutes you can see 118, here also urine sugar is negative. 60 minutes per 140, 90 minutes per 122, and 2 hours per it is again coming to 90, and all the findings are suggestive of there is nil sugar in the urine. Benedict test is negative. So this is normal condition. Okay, the graph you can see this 0 minute per 79 hai, 30 minutes per it is 118, 40 minutes per 60 minutes per 140, 122, and 90 at 120. So it is absolutely normal graph. Okay, normal. So they have mentioned urine is also negative for sugar in all the cases. Okay, so it is absolutely normal graph. So you can see the results shown in the table and the curve represent normal curve, as in a normal curve fasting blood glucose is less than 110 milligram per deciliter. So you can see this fasting blood glucose is 79, so it is less than 110. It rises to peak less than 160 at 1 hour and return to near fasting level, that is less than 140 by 2 hours. Okay, so this is absolutely normal graph. This is how you can identify the normal graph. Okay, this is the end of our first example. Now next we will see second example. You can see this example, second example. So directly fasting it is 148, but here यूरिन शुगर इज नील. 30 मिनट्स पे 175 आ रहा है, लेकिन यूरिन में अगेन शुगर इज नेगेटिव. 60 मिनट्स पर इट इज 250. And absolutely the urine shows a positive, that is 90 minutes per 240, and also urine shows a positive, and you can see this 120 minutes, that is 2 hour, it is 210, and it is positive for urine sugar. Now just you can tell me, this particular graph obviously it is suggesting of diabetes mellitus. Why? Because fasting plasma glucose is more than 126, obviously it is 148, so it is more than 126, and 2 hour postprandial value is more than 200. These two things only required to diagnose a diabetes as a graph. Okay, okay, I am highlighting this so you can take a note of it. Okay, so this is how diabetes graph looks like, right? I hope this thing is very clear according to the criteria. Okay, you just revise the criteria of diabetes. This actually looks like typical value of diabetes. Okay, typical patient, like just like a typical patient, they have given the graph. Okay, now third example, you can see the third example in which fasting is 114, urine sugar is negative. 30 minutes of 120, again it is nil. 60 minutes of 120, again it is nil. 90 minutes of 135, again it is nil. 2 hours it is 138, again it is nil. So you can see this is called impaired fasting glycemia curve. Why? Because your fasting plasma glucose is more than 110, but it is less than 140, so it is not falling under the diabetic category. Okay, so it is called impaired fasting glycemia curve. It is slightly difficult to diagnose, but from the concept you should be able to diagnose this. Okay, rarely it is going to be asked in your exam. Mainly 4 or 3 graphs are there to look for. Okay, so whenever it ranges between 110 and 125, you should diagnose it as a impaired fasting glycemia curve. Okay, this is very clear. Impaired fasting glycemia curve. Now this is very important condition, renal glycosuria. So normal renal threshold is 180 milligram per deciliter. It means that urine will show glucose only if blood glucose values rises above 180 milligram per deciliter. So in case of renal glycosuria, glucose appears in the urine even at lower plasma values of glucose. That means less than 180 per B, urine may it is going to be glucose present. Okay, this occasionally seen in the third trimester of pregnancy and sometimes harmless situations of renal absorption defect in the kidney tubules also. This is potent viva question. In which condition the renal glycosuria is seen? The third trimester of pregnancy and some harmless situations of renal absorption defect in kidney tubules also. Contrary to the above situation, at the time the renal threshold is increased, the glucose does not appear in the urine even when blood plasma glucose rises beyond 180. So इसका opposite है. If it is more than 180, फिर भी यूरिन में शुगर नहीं आ रहा है, then this is contrary to the above renal glycosuria curve. Okay, so this particular condition is seen in glomerular arteriosclerosis because vessels are going to be narrowed, glomerular capillaries are narrow, so glucose cannot be filtered out. Okay, and this particular thing is seen in the elderly patients of diabetes. Okay, right? So you can see this, interpret the value. Fasting pay it is 90 and urine sugar is nil. 30 minutes per it is 120, urine sugar is present. 60 per it is 125, urine sugar is present. So it is less than 180 per B, urine में sugar आ रहा है. So we will strike it towards the renal glycosuria. Okay. Now you can see 90 minutes per it is 100. So urine में भी glucose absent है. 120 or 2 hours per it is 95. and urine में भी glucose it is absent. So this is classically it is suggestive of renal glycosuria. Okay. Yet another important condition, elementary glycosuria, also called leg curve. These two curves are has to be asked in your exam. Okay, definitely they are going to be asked in your exam. So elementary glycosuria, in this case, there is an exaggerated response to glucose loading. Okay, and at 1 hour, there is very high amount of glucose in the plasma, which can even cross the threshold value and come out in the urine, presenting as a glycosuria. So this is you इसको आप ऐसे समझ सकते हो कि ग्लूकोज लोड किया पेशेंट में 0 मिनट पर, suddenly there will be so much rise of glucose, sometimes if it is more than 180, and there will be glycosuria. Okay, and this glucose is then rapidly metabolized and reaches to normal or even hypoglycemic condition by the end of 2 hours. Okay, we'll see the graph. Okay, don't worry. This is rapidly emptying of stomach. This is due to rapid emptying of stomach in case of two conditions, hyperthyroidism and partial gastrectomy. Why partial gastrectomy? Because in the partial gastrectomy, in case of ulcers and malignancy, we will remove the half portion or some portion of stomach, obviously. That's why there is a rapid emptying of stomach. Okay, it is also called lag curve on assumptions that there is a lag in insulin secretion, resulting in high blood glucose at 1 hour period. It is absolutely harmless condition, does not need any active intervention, has to be noted. So you can see this graph. Fasting it is 79, urine glucose nil. 30 minutes it is 118, urine glucose nil. This is the catch point. You can see 60 or 1 hour per, it is directly peaking. It is 198 and the urine glucose is present. Okay, urine glucose is present in this particular case. Okay, and again you can see in your 90 minutes or 120 minutes, it is again coming to normal, and this is about to have a hypoglycemic episode. Okay, or it is having a hypoglycemia 60. Okay, 60 पर hypoglycemia हो जाता है. Sometimes it is asymptomatic, but 60 per usually it is symptomatic. So at the end of 2 hours, the patient is having hypoglycemic symptom. So there is a lag curve. This is how the lag curve looks like. Then there is increased glucose tolerance curve, that is flat curve. In this case, patient shows a little or no effect of glucose loading on blood glucose. So even at 1 hour, your plasma glucose will remain near fasting range. Okay, near fasting range, and values are again within a normal limits. This is due to malabsorption. Absorption ही defective है, hypothyroidism, hypopituitarism and hypoadrenalism. Okay, I hope this thing is absolutely clear. You can say this. Fasting 79, urine glucose nil. 81 nil. 84 it is again nil. 80 per it is nil. 78 it is nil. Almost all the values are nearby. That's why it is a flat curve. You can see the almost flat curve is there. Okay, now one more important concept, OGTT in a pregnancy to rule out gestational diabetes mellitus. It is done in high risk pregnant woman who has family history of diabetes in the family or history of diabetes in previous pregnancy or advanced maternal age. So advanced maternal age per mother is at risk of diabetes. So to diagnose that or to rule out gestational diabetes mellitus, we are performing this OGTT. Okay, again I want to have few minutes on this particular concept. Gestational diabetes mellitus means a new onset diabetes that woman is getting in a pregnancy. Okay, while in case of previously the mother is having a diabetes, and at the time of pregnancy we are observing in ANC visits that patient's blood glucose are deranged and in a diabetic range. So to differentiate between that gestational diabetes or it is previously having diabetes, we are actually going to perform this OGTT. It is done in 100 grams of anhydrous glucose and following our consideration as upper normal limit. Fasting mein it has to be near value of 105. 1 hour per is 190. 2 hours per is 165. 3 hours per 145. So if any two values exceed the above value of graph, it is suggestive of gestational diabetes mellitus. Okay. So let's take an example. It is a quiz for you. Now you can see this graph and just tell me what this graph is suggestive of. Okay. So 0 minutes per, you can see it is 120, 30 per 180, 60 per 190, 90 per it is 167, 120 per it is coming 160. And you can see very trace amount of glucose is there in 60 or 90 minutes. Okay. So you can see this graph is actually your impaired glucose tolerance graph. Okay. This is impaired glucose tolerance. Okay, right? I hope this thing is clear. Now you can see this graph. 0 minutes per 70, 120 at 30 minutes. Okay, 60 per it is 134, but the catch point here is both 30 and 60 per there is showing a glucose positive in the urine. So 134 value, it is less than 180 milligram per deciliter. That's why it is called impaired, sorry, it is called renal glycosuria curve. Okay, renal glycosuria curve. Okay, or I can say lower renal threshold glycosuria, because here your renal threshold is lower. Okay, normally it is 180 milligram per deciliter. It is, you can see here 120 or 134 per B, it is showing a glucose. Now you can see this graph is actually suggestive of it is fasting per more than 126 आ रहा है, pp to bs it is more than 200. It is classical case of diabetes mellitus. I hope this thing is very clear. Now can anyone tell me what this graph is suggestive of? Just having a concept. 0 minutes per it is 84. Okay, it is less than the diabetic range. Okay, good. There is a direct peak from 0 to 30 minutes per it is 84 to 198. Okay, and this 198 is exceeding your 180, and that's why it is showing urine glucose positive. Okay, and you can see again the at 2 hour it is coming near to fasting value. Okay, normal fasting value, near to normal fasting value. Okay, so this is elementary glycosuria or lag curve. Elementary glycosuria or lag curve. Okay, I hope this thing is very clear. All the four graphs we are asking in a spotting examination. Okay, so just pay attention and once go through this topic, and you have any doubt, you are feel free to contact me and post in the comment section. You can also post your doubts in the comment section also. Okay, thank you. We will meet again with a new topic. Okay, thank you.